Good morning, everybody. It is 11 minutes past 7 o'clock right now. Welcome back to Iowa Live. Lou and Jackie here.
Good
Being
morning.
joined in the studio by Dr. Devon Goetz. He is a doctor over at DMOS. And this morning, Jackie, we are going to be talking about a partially assisted robotic surgery when it comes to getting your knee fixed.
Yeah, welcome to your Orthopedic Minute here on Iowa Live. Thank you so much for joining us here today.
You're welcome.
So let's break it down. What does that mean when you are using robotics to assist you in surgery?
So robotic assisted surgery is where the surgeon has a robot to help him do the surgery more precisely as opposed to doing something manually. We still make the incision, we still expose the joint in this case, but the robot helps us make sure that we get the implants exactly where we want them to be.
Okay, so let's just clarify. This is not saying a robot's going to do your surgery. A robot is just
Correct.
doing the precision work that you're controlling the robot too, though, aren't you?
Correct, correct. It's actually more work for us to do it with the robot than without, because there's a lot more preoperative planning with the robot than there is without it.
All right.
And I was going to ask how large it is, and you can kind of see there with this visual that's on the TV. That's a pretty decent size object to be working with.
Yeah, it's very large. That arm would be maybe the size of a football player's arm as opposed to mine.
Oh, really? Okay.
Yeah.
Now, so how do you control this thing? Is it like a joystick, or how do you do this? How do you manipulate?
Yeah, so you bring it into the position, and then the assistant that's running the robot for you tells it that it's armed or ready. And then once it's ready, you use this burr to remove the bone, but it won't let you draw outside the lines. So it's like painting in a coloring book, and it will not let you.
So do you have like a tablet or something, or some kind of screen that you use to put pressure on where the robot goes? Or
Yes, so prior to the surgery, in this case we're talking about partial knee replacement.
Partial
so
knee.
we use the robot to do partial knee replacement. And just to clarify, partial knee replacement as opposed to total knee replacement. In a total knee replacement, we're putting a new surface over the entire surface of the knee joint, the front or the kneecap part, the medial side or inner side, and then the lateral side or outer side.
that's the whole thing.
That's the whole thing. And in
Okay.
a total knee replacement, you would get a surface on all of those parts.
Okay.
But in a partial, we do either the kneecap part, which is called patellofemoral, or the more common one is the medial part right here. So this right here is an example of a medial partial knee replacement. And so what the robot does, before we do the surgery, we get a CT scan of the knee. The CT scan then creates a map or a 3D model of the knee, and then we tell that model where we want the implants to be. The computer gives you a suggestion, and then we tweak it based on that patient's individual needs or preferences. And then during the surgery, the robot will not let you go outside of what you told it to do.
Okay, so what is the robot doing exactly? Is it removing bone, or what is it doing?
Yes,
Okay.
yeah. So after we've made the incision, we've exposed it. It's removing the bone that allows this thing to be where it is here, you see.
Okay.
So it's made these 3 holes, it's removed this. And usually
So it's basically